Hi, I'm Sheva.
And I'm Robert.
We're directors at HeartMath Healthcare, where we oversee HeartMath interventions for the hospital community, bringing resilience defined at HeartMath as the capacity to prepare for, respond to, and adapt in the face of adversity, stress, or challenge. That definition of resilience was adopted based on our 30 years of peer-reviewed evidence-based research by the U.S. Navy. And this, during the COVID-19 pandemic, is a time in healthcare when we need resilience more than ever. Today, we're, in this moment, going to address the topic of resilience as it relates to compassion fatigue, burnout, and exhaustion that our healthcare providers are already facing in week 4 of the pandemic. We were speaking with many of you today and finding out, well, it feels like for a lot of us in healthcare, we've already climbed Mount Everest at week 4, or discovering we're really only at base camp and the climb in the face of this pandemic is about to begin. So we want to give you a tool from HeartMath proven to regulate the autonomic nervous system, regenerate our hormones, our endocrine system, and give us more self and situational awareness, even in the midst of a marathon, as we're all running metaphorically at the moment. And that tool is called the quick coherence technique.
And this particular technique, it's so important at this particular stage with the accumulation of the stresses and compounding anxieties and fears. It's resulting in a level of exhaustion, which is affecting not only our potential home life, our work life, our relationships. And so the more that we can do to help reset the nervous system, to bring in more balance to that physiology, and help reverse the tides, begin to pull back from that exhaustion level and add some more energy in our tank. That's going to be the focus of this particular moment.
One of the Navy SEALs that I trained in this technique described to me how this technique reminded him of what he did when he was an active duty SEAL and was only able to rest in 5 to 20 minute increments. He could not get a full night's sleep because of the tasks he was assigned to. So this technique, while it is certainly not designed to replace sleep, can help recharge your battery on the move, kind of the way my Toyota Prius recharges itself when I'm driving. So the steps are really simple and they can be done eyes open even when you're on the job. And the first step is to focus your attention in the heart, the chest area. To imagine, while you maintain your focus of attention in the area around your heart, that the breath is flowing in through the chest and out through the heart or chest area, a little slower and deeper than our normal respiratory rhythm. Some people find it helpful to count to 5 as you breathe in and to count to 5 as you breathe out. This heart-focused breathing with a paced rhythm by itself begins to regulate the autonomic nervous system.
And once that shift has occurred, physiologically speaking, it's really important to then integrate a particular attitude or emotion, such as more ease or calm. And once we begin to breathe that attitude or emotion, so once our physiology feels a little more safer, a little bit more connected, more centered, the attitudes of more ease and calm can arise a little bit more authentically. And it's that attitudinal shift and integrating that in with the breath that helps sustain the shift, physiologically speaking. So step 2 of this technique is now make a sincere attempt to experience a regenerative feeling such as calm or ease or compassion in this case, and breathe that feeling through the heart area.
It's important to acknowledge that compassion might be for yourself. It could be for the patients that you are heroically caring for right now, but it could also be self-compassion as you breathe in through the heart and out through the heart. This simple technique can be done while you're washing hands in between patients. It can be done preparing to step into a staff meeting or walk into a patient's room, and it can be done as a reset of your system, the same way that when your computer's acting up, you turn it off and turn it back on. Just doing a quick coherence in between work and home can help with that transition. What we find is when people practice this simple skill several times a day, it increases their resilience hormone, or DHEA, decreases measurably their stress hormones, and can help prevent long-term burnouts and compassion fatigue and exhaustion. Our hearts are with you. We're so grateful to you for being the heroes on the front lines of this crisis, and we're here to support. If you want more information or need some private coaching or help during this pandemic time, you can reach out to us at DStress, that's DESTRESS, at heartmath.com, and we're standing by to help. Thank you for all you do.